What a crazy year we've had. 2020 has brought challenges to us that we never thought we would ever experience. Refractive surgery has certainly been something that has been around for 20, 25 years, has been very successful. But really, COVID has surprisingly brought it to the forefront, has made more and more people interested in refractive surgery. And why is that? Number one, I mean, we're a very safe, a very clean procedure. It's performed in essentially almost a hospital-grade room with ventilation systems. It is performed under sterile technique. It is performed with all of our staff in masks and protocols. We're screening people, we're checking them in with temperatures, we're limiting the number of people we have in the rooms. Our office is probably at about 10 to 15% capacity to try and help limit exposure. So coming into Aurora is really a very safe process. It is not something that increases your risk of COVID exposure. It is not something that, it actually is probably close to being as safe as you being at home. We take pride in the fact that we are probably going above and beyond what we need to do in order to help protect you when you do come into our office. In addition to limiting the number of patients that come into our office, we also screen all of our staff prior to them coming to work. They all have to have temperature screens, COVID question screening. In addition, we're all wearing these N95 masks in order to help limit transmission not only to you or to the staff. It is something that we feel is safer when we are working relatively closely with you. During the examination, in your last eye examination, you notice that we get relatively close to the patients. In order to help limit the exposure, number one, it's a relatively brief exam. Number two, we also have placed plastic screens between the staff member as well as the patient. Not only when we're checking your eyes at the slit lamp, but also when we're checking your prescription. With all these precautions, there are some people who still don't feel safe coming in to visit with us, and we totally understand that. We have set up the ability to do virtual consultations where we can sit down and talk with you over Zoom in order to identify what your prescription is, identify what your needs are for refractive surgery, and talk to you about the different options that would be available for you. I believe that refractive surgery has always been a fantastic way to get you seeing without the dependence of glasses or contacts. But now, when people are at home working on the computer more often, their eyes are drying out with their contacts, or maybe their optical shop is closed, or maybe their optician or their optometrist is not able to get them their glasses or contacts, and they're stranded without adequate vision. These have been experiences that patients have had coming in to tell us why they're interested now in refractive surgery. It is something that, obviously the masks have been a huge component of why people are interested in refractive surgery. As you all know, if we are wearing masks and have glasses on, they tend to fog up intermittently. Sometimes we can jerry-rig things to help make that not happen. In fact, I saw a woman who built a fan into her mask so that it would blow the fog off of her glasses. It was really an ingenious way to do this, but certainly not something that is as easy as having refractive surgery. There are the people who are needing reading glasses now as well. For those of us over 50, that is something where we're starting to notice when we're on the computer, on Zoom meetings all day, that we're having to tilt our heads back too much in order to see the computer, or in order to see things reading. That neck strain has also been a big component for people interested in refractive surgery. So there are many reasons why COVID has kind of brought this to the forefront, but it also shows that refractive surgery has been incredibly safe and something that is going to help support you and help you see for years to come.